Revalida de Medicina de Puerto Rico, drug-induced hypersensitivity reactions question bank. Type 1, immediate IgE-mediated anaphylaxis and urticaria. 1. A 30-year-old woman with a known allergy to penicillin is given ampicillin for a UTI. Within minutes, she develops wheezing, hypotension, and widespread urticaria. What is the most appropriate immediate management? A. Intravenous corticosteroids. B. Intramuscular epinephrine. C. Diphenhydramine D. Intravenous fluids. Correct answer, B. Intramuscular epinephrine. Explanation: type 1 hypersensitivity is IgE-mediated and can lead to anaphylaxis. Common drug triggers: penicillins, cephalosporins, NSAIDs, and contrast media. Immediate treatment: intramuscular epinephrine, followed by antihistamines, steroids, and IV fluids if needed. Type 2, cytotoxic antibody-mediated drug-induced hemolysis and thrombocytopenia. A 45-year-old patient with atrial fibrillation is started on heparin. 5 days later, his platelet count drops from 250,000 to 80,000, and he develops a new DVT in his leg. What is the most likely diagnosis? A. Idiopathic thrombocytopenic purpura, ITP. B. Heparin-induced thrombocytopenia. C. Vitamin K deficiency. D. DIC, disseminated intravascular coagulation. Correct answer, B. Heparin-induced thrombocytopenia. Explanation: type 2 hypersensitivity involves IgG antibodies attacking drug-bound platelets or RBCs, leading to cell destruction. HIT is caused by antibodies against platelet factor 4, PF4 heparin complexes, causing thrombosis. Management: stop heparin immediately and switch to a non-heparin anticoagulant, argatroban bivalirudin. Type 3, immune complex-mediated serum sickness and drug-induced lupus. 3. A 50-year-old man is treated with hydralazine for hypertension. 3 months later, he develops fever, joint pain, and a malar rash. His labs show positive antihistone antibodies. What is the most likely diagnosis? A. Systemic lupus erythematosus. B. Drug-induced lupus. C. Serum sickness. D. Rheumatoid arthritis. B. Drug-induced lupus. Explanation: type 3 hypersensitivity involves immune complex deposition, leading to inflammation. Common drugs that cause drug-induced lupus: hydralazine, procainamide, isoniazid, methyldopa. Diagnosis: antihistone antibodies. Management: stop the offending drug. Type 4, delayed T-cell-mediated contact dermatitis and SJN. 4. A 22-year-old man with a history of epilepsy is started on phenytoin. 2 weeks later, he develops fever, mucosal erosions, and widespread painful skin detachment. Nikolsky's sign is positive. What is the most likely diagnosis? A. Bullous pemphigoid, pemphigus vulgaris. C. Stevens-Johnson syndrome, S. Toxic epidermal necrolysis. D. Drug-induced urticaria. Correct answer: C. Stevens-Johnson syndrome, SJS, toxic epidermal necrolysis. Explanation: type 4 hypersensitivity is T-cell mediated and delayed, days to weeks after exposure. SJS-10 triggers: sulfa drugs, anticonvulsants, phenytoin, carbamazepine, lamotrigine, NSAIDs, allopurinol. Management: discontinue the offending drug immediately, supportive care, and ICU burn unit admission.